This webinar is in regards to the Yellow Open Access with Choice Fund plan offered by SchoolCare Health Benefit Plans. My name is Christopher Glenn, and I'm one of the Group Relations Specialists here at SchoolCare. First, we'll go over some terms that we're going to be using throughout the webinar in regards to consumer-driven health plans. First, we'll talk about the deductible, which is the first portion of your coverage paid by you as the insured at 100% of Cigna's contracted rate. Once you meet the deductible, you then go into the coinsurance stage. The coinsurance stage is where the plan pays a large percentage of the cost of the claim, and you as the insured pays a smaller percentage. Under this plan, the coinsurance for any medical claims is 80% paid by the plan and 20% paid by yourself. For any prescription claims, the plan pays 90% and you pay the remaining 10%. Once you pay the amount of the deductible plus the coinsurance, you have reached the out-of-pocket maximum for the plan year. This is the most you would pay per plan year. Once the out-of-pocket has been met, you will be covered at 100% for the remainder of that specific plan year. Now we'll go over some highlights on the Yellow Open Access plan. The Yellow Open Access plan offers self-referring to any contracted Cigna provider in the country. This includes all 50 states and territories. All preventive care and certain generic drugs are covered at no cost. These are such items such as your physical exam, an annual eye exam, and certain generic drugs such as high blood pressure or high cholesterol can be covered at no cost. All other covered medical services and prescription drugs would first apply to the deductible, then to the coinsurance, up to the out-of-pocket maximum. And as I said before, once the out-of-pocket maximum has been met, all covered medical and prescription drugs are covered at 100% by the plan for the remainder of that plan year. This does include if you're on a family plan, all members covered under that plan. This plan also includes a choice fund, which is an embedded HRA provided by SchoolCare, which covers the first portion of your services that apply to the deductible. The choice fund is an embedded health reimbursement account, which offsets your out-of-pocket costs for that specific plan year. To obtain the choice fund, you do have to complete a confidential online health assessment within your mycigna.com account, and it is required annually by the subscriber under the plan. If you are currently participating under the SchoolCare health benefit plans, you would complete your health assessment between June 1st and July 31st. If you are new to the SchoolCare health benefit program, you would complete your health assessment between July 1st and August 31st. Keep in mind, biometric data is not required. The amounts that are provided into the choice fund by SchoolCare are $1,000 for single coverage and $2,000 for a two-person or family coverage. Another benefit added with the choice fund is any remaining fund balance is rolled over to the next plan year, and it may accumulate up to the out-of-pocket maximum. Let's review some of the benefits under the Yellow Open Access plan. This plan utilizes the Cigna's National Open Access Network, which is an in-network benefits-only plan. As discussed before, preventive care and certain generic drugs are covered at no cost. The choice fund, which is activated by taking a health assessment, is $1,000 for single coverage and $2,000 for two-person or family. The deductible under this plan is $1,250 for an individual and $2,500 for a family. The out-of-pocket maximum, which includes both your medical and prescription drug costs, for an individual is $2,000 and for a family is $4,000. The net cost after the choice fund, as long as you take your health assessment, is for an individual $1,000 and for a two-person or family is $2,000. Keep in mind, the choice fund pays for the first $1,000 or $2,000 of the out-of-pocket maximum. All services such as physician visits, ER, labs and x-rays, advanced radiology, physical, speech and occupational therapy, chiropractor, durable medical equipment, and prescription drugs are subject first to the deductible and then to coinsurance, whether it be 20% coinsurance for any medical services or 10% for any prescription drugs. Let's review how an individual would reach the out-of-pocket maximum. The deductible on an individual plan is $1,250. The first $1,000 is paid by the Choice Fund as long as the health assessment was taken. The next $250 would be paid by you as the insured. The next $750 is made up of 20% coinsurance for any medical claims and 10% coinsurance for any prescription drugs. Keep in mind in this section, for prescription drugs, you do have a $75 cap. Once you have paid $1,000 and the Choice Fund paid $1,000, you would reach the out-of-pocket maximum of $2,000 and be covered for the remaining of the plan year at 100%. Let's see how a family or a two-person plan could reach the out-of-pocket maximum. The deductible under a family plan or two-person plan is $2,500. The first $2,000 is paid by the Choice Fund as long as it is activated by taking the health assessment at mycigna.com. And then the next $500 would be paid by you as the insured. The next $1,500 is made up of 20% coinsurance for any medical claims and 10% coinsurance for any prescription claims. Once you have paid $2,000 and the Choice Fund has paid $2,000, the out-of-pocket maximum of $4,000 has been met, and you and anyone else covered under the plan is covered at 100% for the remainder of that plan year. Let's review an example for a two-person or family coverage and how they reach the out-of-pocket maximum. To reach the $2,500 deductible, there is a $300 prescription, which $300 paid from the Choice Fund, and you would pay nothing. You had a $1,600 emergency room visit, $1,600 paid from the Choice Fund, and you paid nothing. A $250 orthopedic physician visit, you had $100 left in that Choice Fund, so $100 paid from that account, and then you pay the remaining $150. Then you have a $350 bill for 6 PT visits. You pay the remaining $350 to meet the $2,500 deductible. Then the next $1,500 is paid in coinsurance. So a $900 prescription at Cigna Home Delivery, you pay 10% coinsurance, but with a cap of $75, so you would pay $75. You have a $250 surgical physician visit, you pay 20% of that visit, so you would pay $50. Then you have a $7,000 gallbladder surgery, you would pay 20% up to the out-of-pocket maximum, so you only pay $1,375 to satisfy the remaining out-of-pocket. Once all of those have been paid, you are covered at 100% for the remainder of the plan year. A $250 chiropractor visit, you would pay $0. A $150 physician visit for an earache, you would pay $0. The same $900 prescription from Cigna Home Delivery, you would pay $0. Some resources you have available to you are your benefit administrator or human resources department. They can help you with enrolling into the health plan or updating any information that you need to. And also, if you are offered a flexible spending account, they can help with enrolling you into that as well. If you had any questions after reviewing the webinar, please contact SchoolCare at 800-562-5254. You can either speak to myself, Chris Glenn, at extension 308, or my counterpart, Jana Dalton, at extension 315. Another resource for any claims issues not being resolved by Cigna would be Jeff Kanarowski of the NEA of New Hampshire. He can be reached at phone number 603-715-9315.